Hello, I'm Phil McGinnity.
Hello, I'm Mary-Louise Bailon.
We both have more than 10 years experience working on dog and cat oral care.
Periodontal disease is probably the disease most often seen among dogs and cats. More than 80% of dogs and 70% of cats over the age of 3 suffer from it, and over the age of 7 it is the most common ailment in dogs. This film assesses the etiology and stages of periodontal disease and gives some information about the products Mars is developing to help prevent the build-up of plaque and tartar that lead to it. Periodontal disease and gingivitis are an inflammatory response to the build-up of dental plaque on the surfaces of the teeth. This build-up of dental plaque from oral bacteria and food particles starts after a few minutes on a clean tooth. In combination with minerals in the saliva, the plaque forms calculus or tartar, which, although it's only a secondary factor in periodontal disease, is very hard and can only be removed by veterinary intervention. An accumulation of plaque on the tooth surface can lead to an inflammatory response in the gums. This inflammation can be eliminated by the removal of the plaque, allowing the gums to recover and become healthy again. If the plaque is allowed to accumulate still further, it can cause periodontitis, which involves the destruction of the alveolar bone and periodontal ligament, breakdown of the supporting tissue, loosening and potential loss of the tooth. This tissue damage is irreversible. Many dogs show some signs of periodontal disease in the form of plaque or tartar on their teeth or gingivitis. In general, smaller breeds can be more prone to periodontal disease than larger ones due to their relatively large teeth compared to the body and jaw size. The crowding of their teeth allows plenty of places for plaque to accumulate. Also, smaller breeds tend to live longer than large ones. And because periodontal disease is an age-related condition, smaller breeds tend to show more disease. In addition, certain breeds show a predisposition towards periodontal disease. There are a number of quite obvious symptoms of periodontal disease in dogs. One is inflamed gums, which can be seen as redness, swelling and possible bleeding. Another very obvious symptom is bad breath, which is often what is first noticed and which needs thorough checking to identify its cause. But there are other symptoms that owners should look out for. Changes in eating behaviour may show that the pet is eating slowly or not at all because of mouth pain. A dog may also rub or paw its face because it is painful or may not want to have its mouth opened. However, changes in eating behaviour may never happen as an animal's natural survival instinct leads it to keep eating no matter what. Dogs with periodontal disease may also show a big change in their temperament, seeming less friendly, sad and old as the disease progresses. Owners are often amazed when they see the reversal of these changes when their dog is treated, as the pet becomes happy and friendly like a puppy again. Beyond these risks to oral health itself, there are also serious potential threats to the dog's general welfare and other organs. The bacteria that cause plaque have been found in dogs' hearts, kidneys, livers and lungs, where they have the potential to cause a range of problems. Treatment of advanced periodontal disease involves dental scaling and polishing under general anaesthesia by your vet. In some cases, a tooth may need to be extracted if it can't be saved. Therefore, it's really worth making every effort to hold this generally preventable disease at bay, rather than waiting until it needs treatment at the vets. So, what are the main methods of preventing periodontal disease in dogs? The first is brushing their teeth every day with a special toothbrush and veterinary toothpaste without fluoride. While toothbrushing doesn't remove tartar, it does prevent the build-up of plaque and is the best method of active home care. However, for many owners, daily brushing is not a favourite option. The pets may not like it, which makes the owners reluctant to do it, and brushing the teeth now and again simply won't do. The research team at Mars Pet Care has developed specialist products that help prevent plaque and calculus accumulation in dogs.
The benefit of brushing the teeth comes from the shear force, which can be described as a gentle rubbing force, which the action of brushing causes at the surfaces of the teeth. This force removes deposits of plaque which are sitting on these surfaces. A number of years ago, researchers at Mars Pet Care realised that it should be possible to create a similar shear force at the surface of a dog's teeth by the action of the dog chewing. However, for this to be effective, the texture of the product being chewed would need to be designed very carefully. After a great deal of research, it was found that the best types of texture are what might be described as chewy but tough. This is exactly the texture of Pedigree Dentastix chews. The texture of Pedigree Dentastix is designed not only to create the shear forces on the dog's teeth, which helps remove the plaque, but also to keep the dog chewing for a significant length of time, typically 1 to 2 minutes.
Just as with brushing the teeth, the removal of plaque is most effective when the rubbing action is sustained for a significant length of time. An added benefit of this sustained chewing is that it stimulates saliva flow. This flow helps to wash away any debris removed from the teeth. However, researchers at Mars Pet Care have gone even further in designing Pedigree Dentastix to be as effective as possible at reducing the build-up of plaque and tartar.
While the shear forces of toothbrushing or chewing a Dentastix can remove plaque, they cannot remove tartar. Over time, plaque hardens to form tartar, and once this has happened, only scale and polish treatment by a vet can remove the deposit. So, Mars Pet Care has included within Dentastix 2 ingredients which have the effect of slowing down the rate of hardening of the plaque. By this means, plaque is kept softer for longer, and so more of it can be removed by the action of the dog chewing Dentastix.
The effect of Pedigree Dentastix on dog dental health was measured in a trial run by an independent university in Australia. The trial followed a procedure that is recognised by vets internationally for measuring the effectiveness of different diets on pet dental health.
In summary, 12 dogs were fed a standard diet for 4 weeks, and then a number of measures were made of their state of dental health. The same dogs were fed for 4 weeks on the same standard diet, but were also given 1 Dentastix per day, and then their state of dental health was measured again. The results showed that by feeding 1 Dentastix per day, levels of plaque were reduced by 38% on average, whilst levels of tartar were reduced by an average of 49%, and some dogs saw a tartar reduction of up to 80%. The trial also measured the levels of gum inflammation. As expected, with the standard diet, the health of the gums declined over the 4 weeks. But surprisingly, with Dentastix added to the diet, the initial gum health was maintained.
While daily toothbrushing is still the best way to prevent periodontal disease, it simply isn't always possible. So Dentastix provides a way of helping to care for the oral health of dogs that is both convenient for owners and enjoyable for their pets.